You should look for a physician who is well qualified in his field because of his training and his experience. I went to Notre Dame, and then I went to Ohio State Medical School, and then did 5 years in general surgery at USC, County Medical Center. And after USC, I went to Harvard for 2.5 years in plastic surgery. So I'm board certified both in general surgery and in plastic surgery.
We're doing a lower blepharoplasty with bifurcation.
Well, you know, plastic surgery is not a magic wand. It's actually surgery. It's cutting, it's sewing, it's wound care, and all of these things are so important. And when you do that, the human body can get into a complication. And that's where you have to have all of that training, that experience to know how to get from the complication to a good result for the patient. This hollowness, this indentation here goes away so you don't look as tired.
Dr. Vecchione is just a great guy. He's easy to talk to. He's very caring. You can feel his caring about you. It really comes across.
When we make our incision, which will be just beneath the lash line here, it's in the patient's expectations are something that we have to really consider very, very carefully. And that's where communication comes in. You have to know what that patient wants and whether it's realistic, and can you achieve that. We have to numb up this whole area because we're going to be under the skin here. If you don't have the aesthetic eye, then it becomes a mechanical cookbook and it doesn't work out as well. Tracy, how are you?
Good.
Nice to see you. Seeing a patient come back after you've done a procedure for them, and they're not only satisfied, but they're ecstatic about it. And they have a big smile on their face and they congratulate you, and you really enjoy that. And so that is really the joy of plastic surgery, is seeing that happen.
I had wanted to do it for years, and I was afraid it was too much money, or I was afraid it was going to hurt, or I was afraid, you know, the downtime was going to be too long. But all of it was a breeze. He was very careful in his surgery. The follow-up care was amazing. He called that night, he called the next day. So you feel like they really care.
That's why you went into plastic surgery, to get that result, and the best result you can get for that patient. And if the patient is happy, then I'm happy.